Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
When John Konfala found out he needed another valve replacement last year, he knew he wanted the same surgeon who had previously replaced the valve in 2007 at Ohio State University, which is near Mr. Konfala's hometown. That surgeon, Dr. Juan Crestanello, is now at the Mayo Clinic in Rochester, Minnesota. So, what did Mr. Konfala do? Well, he packed up his bags and he headed to Minnesota.
Just what he should do.
Yeah.
Both men are with us today to share the story of how Mr. Konfala says that he got his life back. Joining us in studio is Mayo Clinic cardiovascular surgeon Dr. Juan Crestanello. And on the phone from Powell, Ohio, is John Konfala. Good morning to both of you.
Good morning.
Good morning.
Yeah, thanks to both of you for being here. So, Mr. Konfala, when did you first meet Dr. Crestanello?
It would have actually been in 2006, sometime mid-year 2006. I had been diagnosed with I had regurgitation of my original equipment aortic valve, and I was my cardiologist had set me up with Dr. Crestanello, and we had, through a series of examinations and meetings, were gauging the right time to perform the surgery, because although I had significant regurgitation, I was asymptomatic at the time, so we were trying to figure a time that was best and when we should proceed, and that time was January of 2007.
Okay, so just a second, regurgitation, meaning that you had backflow, so the valve
Correct.
wasn't closing
That's
all the way,
correct.
is that right, Dr. Crestanello?
That's correct.
Okay.
So you had a new valve replaced in 2007. Did you always know that you would have to get another one, or was it a surprise when this one started to have trouble?
No, so Dr. Crestanello gave me we replaced my original valve with a bovine valve, and
So
I'm
a
sorry.
bovine.
So that's
Bovine.
there are basically two types of artificial valves: mechanical valves and tissue valves. So is one type of tissue valve that can be made of cow tissue or pig tissue. So
And did you get a cow or a pig? Do you know?
Cow.
Cow. Okay, so and that was 2007.
Correct.
And again, the question was, did you know this was probably ultimately going to wear out and you would need another surgery or not?
Yes. Dr. Crestanello had informed me that on average those tissue valves last anywhere from 10 to 15 years, but that he assured me at the time that he did replacements, and that it wasn't much more complicated than the initial surgery. So I went with the tissue valve because Dr. Crestanello also indicated to me that the level of anticoagulation that would be needed post-op with a tissue valve is not the same. I would be taking an aspirin a day versus,
Instead of something like
going
Coumadin.
on warfarin, that type of thing,
Got it.
which I would need with a mechanical valve.
Now,
So-
you knew that you wanted Dr. Crestanello to be your surgeon again, but he packed up and moved to Rochester, Minnesota. Why did you want
Yes.
him to be your surgeon? Why were you willing to follow him here?
Because the confidence that he instilled, I had confidence in him, and he was just very reassuring the first time around, and I knew that if I ever needed another operation, that he was the person I wanted to have do it.
That's nice, Dr. Crestanello. That's good to hear.
that's very nice of you. So I always remember Mr. Konfala because of the discussions that we had in terms of the valve selection, and as you probably know, he's an avid hockey player, and one of the discussions that we had was the issue of anticoagulation and playing hockey, ice hockey. And he wanted to continue to do so, and that's one of the main factors that played a role in 2007 in choosing the tissue valve versus a mechanical valve.
Oh, so you knew that he was going to get bumped and bruised, and you didn't want him on an anticoagulant any more than just aspirin.
Correct.
Okay, and then how did you get to Mayo?
By car? No, I'm just kidding. How long have you been here?
I trained here initially from 2001 to 2004, and then I moved to my first practice job, which was at Ohio State, and I was there for almost 14 years, and then I came back a year and a half ago.
Oh, good. It's been good here. You like it?
Yeah, it's been fantastic.
So tell us about the most recent surgery. This bovine valve, this cow valve, wore out, and you needed to replace it.
Correct.
And what kind of valve did you use as a replacement?
Well, we end up using a mechanical valve, and that's that was a decision that we made together with Mr. Konfala. And even though he already wanted to play hockey, but he already had gone through another operation, and we really didn't want to do this a third time.
Any post-op complications?
No, he did very well, and the most amazing. So he had his surgery and everything went extremely well, and then he went home, and like a couple of months later, I don't remember exactly the time, I get a letter on the mail with a picture of him on the field hockey. I'm sorry, on the ice hockey rink, playing, and that was really a phenomenal, source of gratification for me to see, one, how thankful he was, and number two, more importantly, how well he has done after the surgery and being able to return to what he really likes to do.
But didn't he have a post-op infection?
No, he had a pre-operative. I mean, the reason why the valve deteriorated was an infection of the original valve.
Yes, so you had to get that cleared up before you put the new valve in.
Correct.
And our infectious disease colleagues helped with that.
Yes.
So how did you know it was infected? Did he have an infection in his bloodstream, or?
Well, this is something that we did not know from before the surgery. That's something that we discovered at the time of the surgery.
Oh, okay. And so then you treated him with antibiotics post-operatively.
Correct.
Well, Mr. Konfala, how are you feeling now? It sounds like it's back.
I feel fine, and actually, as a backdrop, in an interesting side to the story is when I came to the Mayo Clinic in November for the second surgery. Now, mind you, I had not seen Dr. Crestanello since 2007, and as soon as I walked into his office, I don't know if my name resonated with him immediately, but he looked at me and he said, "You're my hockey playing patient." I knew I was in the right place.
Yeah, that's right.
When we talked about the options for replacing the valve, Dr. Crestanello informed me that there was a new version mechanical valve that he could use that would require a lower dose anticoagulation. And my wife was sitting next to me in this meeting, and she's a physician as well. And she looked to me when Dr. Crestanello indicated what the target INR blood thinning quotient would be for this mechanical valve. She kind of looked at me and she says, "Boy, you could play hockey on that level." That. And so after the operation and after I returned to Ohio, I went through my cardiac rehab at Ohio State, and I connected with my cardiologist down here, and had an echocardiogram in March, and that echocardiogram indicated that I had fully recovered, and then again completing the cardiac rehab. Once I completed those two steps, that's when I returned to the ice. I had my INR under control and got a clean bill of health with the echocardiogram.
So INR, it's a measure of how thin your blood is, and you need to keep it at a certain level.
Correct. Correct. It's the INR is a measure of how quickly the blood clots.
Right. Well, what a great story.
Yeah, you're obviously a very grateful patient if you're willing to talk about how the whole process
absolutely.
went.
And I have no problem sharing my story because I want other people that might be in a similar situation to know that, these things can be, as Dr. Crestanello told me the first time in 2006, we can fix this.
All right, patient Mr. John Konfala follows his surgeon to the Mayo Clinic. Now all is well, and he's actually back on the hockey rink. Thanks to our infectious disease colleagues and the skills of cardiovascular surgeon, Dr. Juan Crestanello. Thanks to both of you for sharing the story.
Thank you.